Thanks, Quinton. You can't see bad breath, but you know when it's there. It's a common problem that isn't talked about all that often. For more, here's Panacea's Mandy Sammy.
Bad breath isn't something we usually openly talk about. The woman you're about to hear openly broadcasts her bad breath issues on YouTube.
It's like the rainbow every time I smile, and the breath is just really bad.
It can be hard to tell someone that they've got bad breath, and it's even more embarrassing when you know you do, and you just don't know how to fix it. Dr Dr Speiser is the CEO of the Australian Breath Clinic. He says that it's a widespread problem.
Some of the studies show that 1 in 3 people are chronic sufferers of bad breath. It's a very common problem.
Your clinic's managed to diagnose the specific cause of it. Can you explain how it's done?
Yes, what we've done is we use special machinery that is called gas chromatography that we bring in from Japan, and we've teamed that together with a protocol that helps us identify the 3 main gases of bad breath. By knowing where each of those gases are in the mouth and which particular bacteria make those gases, we're able to determine the actual cause of the problem.
So is there one gas that's most found with people with bad breath? Is there something that's specific?
Well, basically there's healthy bad breath and non-healthy bad breath, and what I mean by that, bad breath can be caused by disease, and when that happens we tend to see more of a gas called methyl mercaptan. This is a feces-smelling gas. Whereas people that have healthy bad breath, which means they may not clean their teeth that well or maybe certain foods, they tend to have another gas that smells more like rotten eggs.
So, but in both cases it's bad breath, whether it's healthy or not?
In both cases it's bad breath, it's just which is more offensive.
How do you actually fix the problem?
Well, we first have to determine the cause, then we generally will put someone onto a lifestyle program to change the actual proteins in their diet. We'll look at the bacteria mix in their mouth because it's bacteria breaking down proteins that are causing the problem. So we're looking at all facets from what's happening in their mouth to what they're putting in their mouth to what they're doing generally in their life.
And what are some of the general causes that you usually find?
Well, high in dairy, high in eggs, high in acids, high in alcohol, high in stress, or anything from not cleaning the teeth too well to actually having low-grade gum disease. Is
it as simple as, having mints and chewing gum, or is there other solutions that are more complex?
Mandy, it's never simple. Look, it's not a simple fix, unfortunately, because there are over 800 bacteria in the mouth. Half of them haven't even been discovered. Bad breath is not caused by one simple bacteria, so you can't just get inoculated or knock that bacteria off. These are normal bacteria that are living in everyone's mouth and throat. They just get out of balance sometimes. So you really need to have a comprehensive means of diagnosing which bacteria are the issues, and then you can go ahead and treat it.
Do you find that people don't really seek help when it comes to fixing their bad breath? Do they see, it's a problem I have to go and see the doctor about?
A lot of people will go to the doctor before they'll come to us, and those doctors generally refer them to ear, nose and throat specialists or to gastro specialists. They eventually end up at us either from a doctor referral or finding us on the internet, but there are very few people around the world that actually do this sort of specialty.
Would you go as far as saying that you're having bad breath is a medical condition?
No, that's probably pushing it a bit. I think it's a lifestyle issue. It's no different to a lot of people. You exercise, you sweat, your sweat smells, but you can have a shower and you'll be fine. And it's the same with bad breath. A lot of people have bad breath, they clean their teeth, everything goes back to normal. But unfortunately for a small percentage, that's not the case. They can clean their teeth, they can do what they want, but their bacteria is so out of balance, they've still got the issue.
So it's not hereditary?
Not hereditary, but it is definitely environmental. So what we'll see is, look, you do get a similar bacteria to your parents. I suppose there is a small hereditary part to it, but it's environmental in that we follow what we learn from our parents. So we'll clean our teeth the same way that we see our parents clean their teeth. We'll eat the same sorts of foods. So you do see a common trend through families.
Now, you've talked briefly about the technique that you use at the clinic, HaliCheck.
Yes.
Can you tell us a bit more about what it is? If I come in and you use HaliCheck on me, what can I expect?
This is really high-tech science. This is similar to what you see on those CSI shows. It's called gas chromatography. And what we do is we suck a sample of air from your mouth, pump that into our machine. The machine vaporizes the air sample, and as each component in your breath vaporizes, it gives off a little electric pulse. And we have this machine calibrated to pick up the 3 main gases of bad breath. So what we'll get is a digital readout after 8 minutes of exactly how much parts per billion, not million, parts per billion of bad breath you will have in your mouth for 1 billion parts of air. And we will know which of the three main gases, and therefore we know which bacteria are causing it and whereabouts it is in the mouth. And this is so sophisticated that this type of technology is now getting adapted for things like cancer and for cholesterol issues and things like that.
Is it the same technology that they're using for cancer?
It is gas chromatography, where basically they're saying that the mouth is the window to the body. So anything that's happening within the body, in theory, you will find some sort of remnants in your breath.
And do you have any general advice when it comes to avoiding bad breath? Just some good tips.
Basically, stay away from dairy, stay away from eggs, eat carbohydrates for breakfast and lunch because proteins are the things that cause issues, and make sure that you have spotless hygiene, no gum disease, and that you see your dentist twice a year.
Dr. Jeffrey Speiser, CEO of the Australian Breath Clinic, speaking there to Mandy Sammy.